Hey guys, welcome to the second video in honor of Mental Health and Bell Let's Talk Week. On January 25th, be sure to send out as many of the following as you can, and Bell will donate 5 cents from each one to mental health initiatives. Today's video is about post-traumatic stress disorder. We all experience unpleasant events at some point, but what happens when it starts to seriously disrupt your life? PTSD is an anxiety disorder which often involves exposure to trauma from events involving death or serious injury, war, abuse, sexual violence, or threats to life or safety. While in school we're taught that soldiers of the world wars develop PTSD, it's not just those in combat who can develop the illness. People with certain jobs, such as paramedics, can also experience PTSD, and of course, everyday regular people can too. There are 4 different categories of symptoms for PTSD. The first one is re-experiencing. PTSD causes intrusive symptoms such as nightmares or random flashbacks and thoughts that appear out of nowhere. Certain words, objects, people, or places can trigger these types of experiences. Symptom number 2 is avoidance. If you've been bitten by a dog, you might avoid one when you're walking down the street. People with PTSD are likely to avoid certain places, people, events, or objects that remind them of their trigger. Symptom number 3 is arousal and reactivity. PTSD causes people to feel anxious all the time. This includes constantly feeling on edge, being easily startled, having trouble sleeping, or having angry outbursts. And the 4th symptom is cognitive and mood. Like depression, PTSD can cause you to lose interest in once enjoyable activities, have negative thoughts about yourself or the world, distorted feelings of guilt or blame, and troubled or heightened ability to remember key events of the event. And the thing with all these symptoms is that sometimes they appear right after the event and other times they appear months down the road. Sometimes people have these symptoms go away after a few weeks, and this is called acute stress disorder. But if the symptoms persist and begin to affect one's ability to function, then it's likely PTSD. If you or a loved one has PTSD, it might be hard to talk about it. A lot of people feel guilt or shame because someone might have told them to just get over it, or they feel that what happened was their fault. However, this is not true, and there are many options for those suffering from PTSD. Cognitive behavioral therapy is shown to be very effective in helping those with PTSD. A therapist can help you manage your thoughts, feelings, and behaviors and teach you how to deal with triggers and stress. You can also learn relaxation skills and techniques to help bring you back to the present. In some cases, exposure therapy might help you talk about your experiences and reduce avoidance. This is one that a lot of people are scared to try, but your therapist will only suggest it once you both agree that you're ready. Medication might also be a viable option to help with depression or anxiety symptoms. And there are also support groups for people suffering from PTSD where you can share your own experiences and learn from others. If you have a loved one who suffers from PTSD, start by educating yourself more about the illness. It's important to understand that people who experience PTSD may withdraw from family and friends, so remind them that you're there to listen when they're ready. Don't take their behaviors personally. If they avoid certain situations or overreact to a minor problem, it's not because of you, it's because of the illness. Ask what you can do to help, but don't push unwanted advice. If a loved one's PTSD is starting to affect other family members, it might be helpful to seek family counseling. And it's also very important to take care of your own well-being. If you're experiencing difficulties or are unsure how to help your loved one, there are also support groups available for family and friends. Be sure to keep watching this week for more videos on mental health. And if you check the description, I've left some resources and hotline numbers if you need them.